Myself, Shubham Shimpi, roll number 137. My topic is immunosuppressant drug. Uh, Immunosuppressants. Immunosuppressants are drugs which inhibit cellular, humoral, or both type of immune response and have their major use in organ transplantation and autoimmune disease. Classification. First, calcineurin inhibitor. Example: cyclosporine, tacrolimus. Second, M-motar inhibitors, sirolimus, everolimus. Third, anti-proliferative drugs, also called as cytotoxic drugs. And fourth is glucocorticoids. And the fifth type is biological agents. First, calcineurin inhibitor. Therapeutic uses. Their therapeutic uses are organ transplantation like kidney, liver, heart, either alone or with other. Immunosuppressive agent, corticosteroid. Autoimmune disorder. Low dose 75 per mg per kg. Example: endogenous uveitis, rheumatoid arthritis, active Crohn's disease, psoriasis, nephrotic syndrome, severe corticosteroid dependent asthma, early type 1 diabetes. Adverse effect of calcineurin inhibitor: nephrotoxicity, neurotoxicity, hepatotoxicity, hirsutism, hypersensitivity, hypertension, hyperkalemia, hyperglycemia, hyperlipidemia, and hyperplasia of gum. Second type, anti-proliferative drugs. Their uses is, they are also called as cytotoxic drugs. Their uses are anti-proliferative drugs. Uses: acute glomerulonephritis and rheumatoid arthritis, Crohn's disease, severe psoriasis, pemphigus, myasthenia gravis, uveitis, and chronic acute hepatitis. Adverse effect of anti-proliferative drugs: bone marrow depression, leukopenia, thrombocytopenia, gastrointestinal toxicity, hepatotoxicity, increased risk of infection. Third type, glucocorticoids. They particularly inhibits MHS expression and activation proliferation of T lymphocyte. Expression of several IL and other cytokinin genes is regulated by corticosteroid, and production of adhesion molecule is depressed. Uses of glucocorticoids. The corticosteroids are widely employed as companion drugs to cyclosporine or other immunosuppressant in various organ transplants. In case graft rejection set in, large dose of corticoids are employed for short periods. They are used in particular all cases of severe autoimmune disease, especially during exacerbation. Fifth type and last type of immunosuppressant drug is biological agent. They are classified as TNF-alpha inhibitor, IL receptor antagonist, IL-2 receptor antagonist, anti-CD3 antibody, polyclonal antibodies. The example of biological agent are: first type TNF-alpha inhibitor are etanercept, IL-1 receptor antagonist is anakinra, IL-2 receptor antagonist is daclizumab, anti-CD3 antibody is murinib, polyclonal antibodies example is anti-thymocyte antibody, rho D immunoglobulin.